All right, so let's talk about eyes and ears. So a lot of times with our eyes, we're dealing with glaucoma, and sometimes we're going to have a couple different medications that we're going to be administering for this type of disease. So remember, if you have 2 or more eye drops for your patient, keep in mind you need to wait 10 minutes between each drop from each different drug so that it can take effect, and then the next one can go on board. You can never give 3 different types of eye drops at the same time. And so that's an important concept to keep in mind as you go forward. Um, Now, remember with your beta blockers for the eyes, timolol is very classic. Remember, it has that OL at the end? That means it's a beta blocker, right? One of the things that you need to keep in mind that if, okay, let's say we're taking a metoprolol during the day and a timolol in the eye, that's a lot of beta blocker going on. And so we're going to make sure that their blood pressure is in order, and they will work together to decrease the blood pressure in the body systemically as well, not just in the eye. So keep in mind that these medications are not just separate from each other, but they do work systemically as well. And so you have your alpha adrenergic agonist, remotadine is there. And so we're going to be watching for the side effects that would be the same as those drugs being administered orally. Um, just looking at a couple of the other eye drops that are there, they pretty much, ATI lists the greatest hits. And so as you're looking through, there's antimicrobials. You've learned amoxicillin as a general antimicrobial. In the eye, it's just, you use it a little bit differently. But remember that they're all the same. And if you don't know how to instill eye drops, feel free to take a look at that to do so. And so miscellaneous drugs are the last thing. And I'm looking to see what they have. Neuromuscular blocking agents. Um, these aren't used quite as much at all. So just keep in mind whenever we're doing central nervous system medications, we're always watching for CNS effects, right? Lethargy, fall risk. All those things are important for us to keep in mind as you go forward. Here they also have baclofen, and I use baclofen, or you have your cyclobenzapine, your metaloxone. They have things now that you might know their name brands better: Scalaxin, Xanaflex, Flexeril. Those are things that will help with muscle relaxing. And so again, with these muscle relaxing drugs, relaxing the muscles, CNS effects again. Safety, safety, safety. And so we're going to watch those drugs for those adverse side effects and make sure that our patient is safe. Just looking through the roundup of this chapter, Miscellaneous Central Nervous System. Take the questions at the end, remember, and life is pretty good. Chapter 16 is Sedative Hypnotics. And if we're sedating our patient, we're going to be worried about their safety risk. And so keep in mind your alprazolam, lorazepam, those are your benzos, right? And temazepam the same way. And so we're going to be watching these patients for CNS depression as well as toxicity because they are controlled, right? So keep in mind that those types of drugs are things that we want to watch for dizziness and fatigue. Intravenous anesthetics. I'm looking to see the drugs that are there. Just remember, intravenous anesthetic, what killed Michael Jackson? Same thing. And so we want to make sure that we don't sedate them too much that they die. But we also want to make sure that we keep them safe in order to protect their life. So, sedative hypnotics. Safety, safety, safety. That rounds up Unit 2. So there you go. We're going to move on. I will post more tomorrow.